Look, we got infected almost 10-15 days back. That time, the system was not so packed up. I mean, still, even though we got the report after almost 48 hours, which was not the case when we got earlier we used to get report within 24 hours. So that was something, an alarming thing for us. Now it is even 72 hours, and now even the tests are not happening. I mean, I wanted myself to be tested again for the negative one, but I could not get an appointment. So the doctor told me that since you're already past 14-15 days from the date of fever, so you don't need to actually get yourself negative tested. You already have survived, so don't worry on that part. So that's how, by God's grace, we have passed on this. Now if I look back, I just can't believe that I have gone through it and I have passed out of it. I mean, it just looks very, very terrible out here in India right now. People are not getting beds. I mean, people are, succumbing to the COVID just like that. I mean, within a day or two, it aggravates like anything. I just can't believe it that I had passed through it. Maybe we had been having some, aloe vera juices and some immunity building things for last so many years. That may have helped us. Maybe some the medicines which my homeopathic doctor gave me, that maybe had helped us. I don't know what happened, but something had happened, and miraculously I escaped this thing. So that's what I can say. Look, the situation right now is overwhelmed. I mean, you can plan out for a certain number of test cases and all, but currently it's a deluge kind of thing. I mean, every day if you see the numbers, that itself will tell you that every day there are around 300,000 plus cases being detected, which means the system is already under too much of pressure. That, I mean, you can't expect to plan out for this. But although the government is now doing their bit, but again, if you look back currently, still it is falling short of that. So, I mean, in fact, I am part of a group, which is our college group, St. Xavier's College, which one of my colleague, Royden, who is also part of your channel, is there. Now, this group, we are working together to, try to find out where the ambulances, where the oxygen cylinders are, where there's a bed available, a plasma available, and we are trying to connect people with the requirement. So I mean, we are trying to do our bit as much as possible. Currently, I mean, when this pandemic started recently, last 10 days, there were a lot of information floating around, but that was not verified. So people used to get, kind of frustrated with that information. So what we started doing was, this group is, we have started verifying the information as to an hour before, or say 2 hours before, and then pass it on to the person who is actually needing it, so that he does not get bogged down with so much of information, just goes to the focused list and tries to get the resources as quickly as possible. So that is what we as common people are trying to do. I mean, that's what in our hand, and we are trying to do as much as possible.